part of the ankle sprain video. You've seen the anatomy. If you haven't watched that video, I highly recommend go and watch that one first, because then you'll understand what all the nuts and bolts are that lead to ankle injuries and what's going on with the anatomy. But now we're actually going to do a little bit of a case study of what you want to be looking at and what are the practical things that you can do to prevent reoccurrence, because with ankle sprains, they're the most common injury, really the most common injury in the general population, not just in dancers, but they're also the one that tends to become repetitive. If you've damaged those ligaments and they've become a little lax, then we've got an instability there that needs to be addressed so that we don't keep doing it. How many people say, I keep rolling that same ankle all the time? Dahlia actually did this just recently, rolled her right ankle, but it was actually the first time. She christened her ankle with a brand new ankle roll. Not too dramatic, right? You were able to kind of keep going. She's just backing off the jumps for the moment so that allowing it time to heal, but she wasn't in too bad a state that she had to actually, completely take time out. So as you've seen, there are different grades of injury, and you need to use different strategies depending on how severe the injury is. Anything that's really not resolving within a couple of days, you need to go and get a healthcare provider to look at it and assess and make sure there isn't anything more serious going on. But we're just going to look at sort of your common and garden ankle sprain, how we can assess, look at some of the jigsaw pieces that led to it. We could say, well, yeah, I just rolled my ankle, it was a freak accident, but more often than not, there are some predisposing factors that led up to that issue, and therefore we want to make sure we're addressing all the jigsaw pieces so that we don't miss anything that might lead us down that path again at another time. Were you in heels or just regular dance shoes?
Regular shoes.
Regular shoes. So it was a jump land? Or?
Actually, I was on an uneven surface walking.
Oh, it wasn't even in dance club. There you go. How many dancers do I see with ankle sprains that didn't even happen in a dance studio? It's just those sidewalks, right? So let's have a look. We're going to have her lie down. And we're going to start by looking at the joint itself. Now, this wasn't a severe injury, so she hasn't blown out any of these ligaments. They're still all present and correct and attached. Remember, let me just grab my little spare foot. Remember, the first ligament to get damaged is that anterior talofibular ligament. Go and look at the anatomy so that you know where that runs. But it's basically just coming from that talus bone in the ankle up to the fibula bone. But on the body, we can find it just over this sort of area. I'm just going to stick my thumbs in. You can feel that? Yeah, just rolling my fingers over that ligament. You need to be an experienced practitioner to be able to find these ligaments. I don't expect you to find them on yourselves, but it's roughly around that sort of ankle bone area, just below it, and often that's where you'll see any swelling that's going on. We've got a little bit of puffiness going on this one, that's not present on the other one. So you can see that there was a bit of issue there, a bit of inflammation going on. So the first thing I'm going to look at is the subtalar joint. On the first video, you'll see exactly where that is. Remember, that's where the talus bone is sitting on the calcaneus, the heel bone there. And that's the joint that allows the heel to swing in and out. And typically when we've sprained the ankle, that heel has gone under that way. It can get a bit locked up in that position after the injury. So we want to be sure that we've got movement restored to that joint. So again, this is something that a healthcare practitioner would do on you. You can't actually really do this on yourself because we're the wrong end of our bodies to do it. But I'm basically just going to lift up her heel bone here and just stabilize the front of the foot and just swing that heel bone out. And we can feel that it'll swing inwards, but outwards, not so much. So we can just get another shot of that. So we're swinging inwards And as we're going outwards, it really doesn't want to go. Is there any pain or pinching as I'm doing that? A little bit. So it can get a little bit nipped and pinched in this area as we swing out. Now that joint is a major shock absorber as well. So it's really important that we're getting that joint restored to movement. I'm just going to compare it with the other one and see if we've got a similar issue. Now you can feel that one just swings nicely. Yeah? Swinging in the breeze, no problems there. So it's always good to be able to compare one to the other. So this one needs a little help. Now we also need to look at the soft tissues in the area, the muscles. Remember, there are muscles that pull the foot in and there are muscles that pull the foot out. And typically, if you've rolled inwards on that ankle, the muscles that pull in have got a little short and tight. In the moment of injury, they go, and they kind of get stuck there, and that can be part of what's restricting that foot from coming back under you. And if that foot's going to keep wanting to go in, you're more likely to roll it again. So the muscle that does that, your tibialis posterior muscle, sits just on, it's something, again, it's quite hard to find on yourself being specific if you don't know the anatomy very well, but where your shin bone is here, just at this lower third of your shin bone, if you just wrap your fingers around the edge of it there, and you can probably feel, I'm just pinching into a bit of that muscle belly there, and you can feel it's a little tight, whereas this side doesn't. I mean, they're tight in dancers typically, generally, but that feels to me a little different, does it to you, than this side? Yeah, so we want to make sure that that muscle's been released. It does get stretched as part of a calf stretch, but it's not very strong. You might need some hands-on work into that. You can get the fingers in there yourself and just do a little rub and release. You don't have to dig too hard, but if you've got issues there, then you might want to go and get a treatment and have someone release that muscle up for you. Okay, then the muscles on the outside that run down the outer part of the lower leg, they pull the foot back outwards. And sometimes if you've gone on that inward on that ankle quite sharply, they can get a little bit upset as well. So we want to just assess, yeah, and that's very stringy in there. That to me actually feels a little bit older than a recent injury. An experienced practitioner, you can tell the difference. That's quite juicy, that one, whereas this one is a little bit kind of what we call fibrous. That spot there, is that a little nasty? Yeah, that feels a little bit like it happened in the injury. That feels a bit fresher to me. This is something you can't really see what I'm doing. That's why I'm articulating it, because it's something I'm feeling rather than something you can see. But it's just, again, jigsaw pieces. You know I love my jigsaws. This tells me that there was probably a little bit of a stiffness issue in this lower leg before the injury, which might be why it wasn't able to deal with that quick motion of a wobbly paving stone. Okay, now I want to test the strength of those muscles. So I'm going to ask you, if you push your foot inwards, so we're going into that sickle position against my resistance. Good, oh, very powerful. Okay, and then push outwards. A little weak, yeah, a little wobbly. We really want those in-pulling muscles and out-pulling muscles to be balanced, because then they hold that ankle in a nice neutral position. So we can do a little strengthening exercise for that, which I'll show you in a moment. But nothing happens in isolation in the body. Just because we rolled the ankle doesn't mean that the rest of the body was completely oblivious to what was going on. And similarly, there might be patterns further up the kinetic chain. Remember that phrase, kinetic movement chain of the body. There might be something further up that, again, predisposed this to happen. So I want to have a little look at that. So I'm going to be looking up the line of the body here and using her ankle as a little marker. I'm just going to tilt the foot as if she's walking. So I'm going to mimic walking. You just keep nice and relaxed. And we can just see a little bit that this thigh is rolling inwards as I do that motion. It's just tracking inwards. Let's compare that to the other one. Whereas this one goes straight up and down. Can you feel that? Mm-hmm. Yeah. So again, that just tells us we've got a little bit of a tendency for this leg to want to collapse inwards. You've probably seen this in some of the other videos I've talked about because it happens so commonly in dances. It's not unusual. Remember, there's never anything wrong with the body. It's just responding to stimulus. We just need to address whatever it's responding to, make some accommodations for it so that we're not exaggerating these patterns over time. So we'd want to release up that tension, which is just in the fascial layer here, which is causing that tendency to roll in. I would also have a look at the gluteus medius muscle. Remember, that's the muscle on the outside of the hip here. If I just get you to bring that hand up, it just sits as a teardrop on the outside lateral part of the hip area. And again, if it's tight, then it tends to allow for that knee dropping in position that we're seeing here. So I'll bring that arm up as well. Again, you won't be able to see what I'm doing, but I'm just pressing into that muscle just to assess for its tone. You can do it yourself. I tend to use the knuckles on myself and just roll into that, that muscle and see if it's tight. A little bit higher up here. Yeah, we've got a little bit of tension up in that. There are other videos that I've done. If you look at the video on rolling or look at the video on hip stretches, you can see how to release that gluteus medius muscle. But that's important. When we come into doing some stability training for the ankle, we want to make sure that we're not reinforcing patterns that are already there, right? We want to make sure that we're doing those exercises from a neutral position. So you need to address those things before you come into the strength training and balance training. Okay, so what we're going to do just whilst we're on the table is a little exercise. We saw that the muscles that bring the foot outwards are a little weak compared to the muscles that bring the foot inwards. So we're going to use a band for this. If I get you to sit up for this, and I'll just grab a band. So you can do this yourself. What you're going to do with the band, if you just wrap it over the foot, if you actually bend that knee up so then we can see a little bit better, and we're going to just double over, and then with the long bits, you're going to hold that in your hands, and what we're going to do is we're going to pull that foot into a more sickled position, and you want the bands this way a bit, that's it, because, and actually point it a little bit more, there you go. And then what you're going to do is bring your foot towards me against the resistance of the band. Good. And come back, release. Good, make sure your shoulders are relaxed as you do it, there you go. And then bringing that foot against the resistance of the band. Good. Okay, so we're firing up those perineal muscles. Make sure your leg is neutral to do it so that the muscles are lined up correctly. And you want to do sort of 3 repetitions of that, then rest and relax. Then you can repeat that. And just if you start to feel that muscle tiring out, then that's the point to stop. And you'll be able to increase your repetitions over time. Okay, but then that means we're starting to get the power back and getting the balance back to support that foot in a neutral position. Okay, so now we're going to come up into a standing position and see what this foot is doing under weight bearing. Okay, so there we didn't have the body weight involved. So just looking at it, first of all, just in a neutral standing position. And there is a little tendency with this right foot for it want to kind of drift inwards. Which is just her normal anatomy, but the arches are actually pretty well supported there. There's not too much of a rolling problem. There's a little bit of an internal rotation. So what I would suggest for her, if you go and watch the video on turnout, you'll see more detail about this. But even though you're in a parallel position, what I want you to do is actually use your turnout muscles and use them to rotate, and really feel those calves and shins rolling round without letting it come into tension of the foot. So the feet can just hang out. So you're rotating there, then let that go and relax, completely let it flop, blump, and you feel those sort of shin bones flare out a little bit. It's only subtle with you. And then rotate again, turn out, line up, Yep, good, 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 good. And then let go. Boom. Yeah. So you can feel that difference. Rotate and line up. Good. And down. So when you're in that dropped position, we're actually sort of shearing the ankle and it's not in a neutral position. So any exercises that we're going to do, we want to be using that rotation. And a good image I like for that is imagine you've got candy cane spirals on the legs and they spiral, spiral, spiral into that turnout. And then if you were to do a rise, for instance, you just spiral so much that you rise off the floor. So we keep that motion going through the kinetic chain. Okay. Remember, when we damage ligaments, we damage our balance sensing, okay? We have receptors and sensors in the ligaments in the feet, also in the muscles and tendons as well, that tell us where we are in space. If you've injured those, then often we've injured that mechanism and we need to make sure that we put that back in. Strength is of no use to you if you don't have a good coordinating organization of how to use those muscles. Just doing the muscle exercises in space doesn't teach them how to work in action, and we need a good signaling system in order for those, remember I always talk about muscles being like instruments in an orchestra. We need a good conductor to keep them working together. Balance training is giving you a good conductor for your orchestra. Okay, so what we're going to do first of all is just have a check and see what the balance is like with these feet. So let's do the one you haven't injured first and just stand on one foot for me. And what we're just looking for is how much correction she's having to do there. So there's a little bit of twitching going on, that's quite normal, but it looks relatively stable. And now let's come on to the other foot. And you can see automatically she's already worried, right? Already going, whoa, and there's a lot more kind of wobbling going there, and the whole leg's kind of, whoa. Okay, relax, don't want to overstress it. So there we can see real evidence, an injured ankle, we've lost some of that balance. So we need to make sure we're addressing that. A good way to do it is using a balance disc or a wobble board. I'm just going to grab mine. But if you don't have one, then you can just put a cushion or a pillow on the floor and use that. You just want something that makes the surface a little more challenging to stand on. So we're going to give you that. So if you stand with both feet on that, yep, and it's going to make life really horrible for you for a moment. So first of all, you just want to get a feel for that. All those little corrections she's having to do are all waking up all those receptors, okay? This isn't about being in a perfect balance. This is about waking up and exercising that signaling system. So we want it to be challenged. That's the point, okay? But as you get more familiar with it, you start to be able to find that neutral place. Like, where is my middle? Where can I find that stable place? So it's helping you find your center, okay? And there you go, you're already starting to accommodate a little bit. If you're doing this for the first time, if you're not used to it, do it next to a wall, make sure you've got something to hold on to. I'm just giving her a little bit of steadying here so that she doesn't feel like she's about to fall in space. Okay, and then just step yourself off that. So we would then progress to, once you can get yourself relatively stable on 2 feet, you can then try closing your eyes. What I noticed there, you probably didn't pick it up quite so much on the camera, as soon as we got on that disc, her eyes were like fixed, staring at one spot, because we use our eyes to balance, right? We use our ears to balance, we use other senses. To really build up our internal cueing for balance, we need to take the eyes out of the equation. When you go on stage, you're in blackout or being blinded by stage lights, this isn't as much use to you. So we need to be able to balance without that. So a progression for that would be to stand on 2 feet with your eyes closed. And then suddenly the whole world shifts, right? So really make sure you've got something to hold on to steady yourself. The progression then would be to do 1 foot at a time. So then you go to 1 foot with the eyes open, and then 1 foot with the eyes closed. So you can work up and up with that. But really be incremental with it. Don't do too much. Ankles can get quite angry, particularly when they're post-injury. You won't feel it at the time, but the next day you might be like, oh, that really feels, you know, like it's flared it up. So be gentle, do a little. If you're all right the next day, then you can add a little bit more. Build it up slowly. Okay, now we're going to do one final little exercise that's a really good one. I recommend all dancers do this, whether you've had an ankle sprain or not. This is great for getting control all the way up the chain of the foot through to the hip. And it particularly helps us work our inner thigh muscles, okay? Really important for us as dancers to have that inner thigh support. And this is going to be a really good exercise for that. So I'm just going to switch my disc for a ball. So what we're going to do here is we're going to, in a parallel position, we're going to pop that ball between the ankle bones. Okay, so see if you can grab. I think you might need to go a little bit lower. There you go. Hook it under your ankle bones a little bit more. Does that feel stable? Yep, yep. Otherwise it'll shoot out at the back. Now what she's going to do now is do a slow rise up, and we're not allowed to let that ball go. Yeah, very good, well done. And come down. Okay, have another go. So we're having to, you're probably using that rotation we were doing, right, to hold that ball in place. So it really helps you to lock those ankle joints into that neutral position and recruit all of the muscles above to stabilize it. And if your ball flies across the room, then you've lost a bit of that rotation control. So even in parallel, we want those candy cane spirals working, drawing the insides of the legs together and allowing us to keep neutral with our foot. Okay, so that's just a few things. You can let the ball go now. A few things that you can do if you've had an ankle sprain, if you know you've got a bit of instability there. Don't just ignore it. It will jump up and bite you later on. So make sure you're doing some strength training, some balance training, and then always, always take what you're doing in this isolated context and take it in, mindfully take it into class, okay? We call it practice for a reason. We don't just do these practices on their own. We have to put them into action as well. So remember, if you're in class, right, remember those spirals. Imagine as I'm doing the releve in class that I've got the ball between my ankles, so that the brain learns that that strength doesn't just exist when you're doing exercises on the floor, it exists when you're in motion as well. Okay, good ways to stabilize those wobbly ankles.